Hi, my name is Neil Ferris, and my chosen occupation is as a surgical technologist. Surgical technologists primarily fulfill the first scrub role. So, before an operation, they help prepare the operating room by setting up sterile surgical equipment and supplies, such as drapes, gowns, gloves, suction tubing, and receiving solutions and medications from the circulator. Surgical technologists assemble the sterile equipment, check to ensure it is all working properly, and make adjustments as necessary before the case. Once the surgeon gets to the operating room, they assist the surgeon with putting on his or her gown and gloves, as well as assisting them in placing the sterile drapes on the patient to create the sterile field. During the procedure itself, the surgical technologist is responsible for anticipating the needs of the surgeon by passing instruments and providing needed supplies such as sponges, performing counts of the sponge, sharps and instruments, and providing solutions and medications to the surgeon. Surgical technologists sometimes fulfill the role of the assistant circulator based on state law or hospital policy. In this role, a technologist assists in transporting patient to the operating room. They help position the patient on the operating table and prepare the patient for surgery by performing skin prep of the incision site. During the procedure, the surgical technologist will assist with obtaining additional supplies for the first scrub surgical technologist, whatever they may need, such as sponges or suture, assist with counts, again, replace full suction containers, providing sterile dressings at the end of the procedure, and assist with moving the patient from the operating table itself to the stretcher so that they can be transported to PACU. Surgical technologists must be prepared to work hand in hand with all of the staff in the OR. This includes the surgeon, the surgical technologist, a first assist, CRNA, and circulating nurse, as well as anesthesia and imaging personnel and materials management coordinators. Possible work settings include hospitals, surgery centers, and outpatient facilities. The educational requirements for a surgical technologist require a minimum of a high school diploma or GED. Either one is sufficient. The successful completion of an accredited surgical technologist program. These programs usually last 2 years. Once the accredited surgical technologist program is completed, one must then go on to pass the surgical technologist, or also known as the CST exam. The certified surgical technologist continuing medical education. So the license is valid for 4 years, and then surgical technologists are able to take the CST exam to renew their license up to 6 months before theirs is going to expire, so that they can continue to work. The main professional organization that supports surgical technologists is the Association of Surgical Technologists. There are others. They include the Association of Surgical Assistants, the Foundation for Surgical Technology, and the National Board for Surgical Technology and Surgical Assisting. So in conclusion, as I stated in my timeline, I am currently employed by Advent Health Wesley Chapel as an anesthesia technician, which I plan to continue for a couple years to support myself. After finishing up the spring 2019 semester, I have only 6 credits remaining. I haven't yet registered for summer classes, but I'm expecting to graduate in either May or June of 2019. Upon completion of my Bachelor of Science degree from USF with majoring in health sciences and a concentration in biology and health management, I plan to apply to the Pasco Hernando State College Surgical Technology program. Once I complete the surgical technology program, I'll have to make an appointment to take the CST exam to gain my license. After completing the program and passing the CST exam, I'll begin my search for a job as a surgical technologist. Ideally, I'll be able to acquire a position at Advent Health Wesley Chapel, which is the hospital I am currently employed at as an anesthesia technician. I plan to work for a few years in an effort to gain experience in the field and to also save up some money for graduate school. My ultimate goal is to get my master's degree in health administration from USF and then work in the front office of a hospital. These front office hospital positions include hospital CEO, the CFO, which is the chief financial officer, department manager, clinical administrator, and hospital marketing staff.